Welcome back to Level the Playing Field, where we talk about sports medicine and orthopedics and try to get you all the best content and information that you need to make the best and most informed decisions. We're going to talk about the top 3 reasons for people to have injuries after sports, and you'll be surprised by the third one. Let's get into it. Like and subscribe. Please follow this channel for more information like this. Let's get it. So top 3 reasons for people to sustain sports injuries. Let me start off with a little, pretext. Okay, so our goal is to prevent injury in the first place. We don't want to see you injured. We want to prevent that from happening in the first place. And so it's important when we're kind of analyzing situations that we get to what causes the injury in the first place. What are the risk factors? So let's start with the top 3 risk factors and how we can combat those in turn, right? And so the first one I'm going to talk about is deconditioning. All right, so we see a lot of injuries. We talk about ACLs and things like that a lot. So ACL injuries happen a lot for people who are deconditioned, right? And so think about your muscles around your knee and around your leg as protective. They're keeping your knee joint where the ACL, your cartilage, and your meniscus is. It's keeping that joint from taking too much stress and force, okay? So if you have weakness throughout those areas, throughout those muscles, then those joints, those critical components, they can take more force. They can be injured more easily. And so we see that a lot with knee injuries in particular, hip injuries too, right? When the muscles around the joint are weak for any reason, deconditioning or overtraining, we'll get to that, but deconditioning is a big one. So what you'll see is people who have not been necessarily conditioning their bodies appropriately, trying to do quick cutting, pivoting activities. Those situations are just a setup for injury. So what's the takeaway from that? Well, if we're gonna be doing quick cutting, pivoting activities, sports activities, which, I encourage you to do if you're passionate about that, you need to be adequately prepared. You can't just jump into that situation. You need to have strengthened the muscles around that area, right? To keep it strong enough to protect you. You need to have adequate core strength right here, right? Because everything flows through the core to make sure your movements are appropriate. Sometimes that means working with certain coaches if you're gonna play at a high level, right? Movement, kind of functional movement evaluation coaches to make sure that you're moving in a way that's safe. So deconditioning or poor movement, that's the number 1 reason, all right? The second one we're gonna talk about is playing conditions. Playing conditions is a big thing. Now, this is a straightforward one. You might think that, for instance, if you're playing football, you're on turf and it's raining, it's slippery, yeah? More slippery situation, that can lead to a higher risk for injury. You slip and fall, you twist your knee in a way you're not expecting, you injure that knee, you injure that area. There you go, it happened there, okay? But then there's more factors to it, right? There's been controversy about turf versus grass fields and what role they may play in the way people kind of pivot and cut. The idea being, certain situations when it comes to turf versus grass may predispose like your foot to stick, right? And then you twist and suddenly the knee takes the injury, right? So conditions like that are things to keep in mind. Equipment issues, right? So we've seen that, for instance, if you look at high school sports, those schools that maybe don't have the resources, right, for the best equipment, the best helmets, the best cleats, the best what have you, the best padding, right? They're gonna be at a higher risk for injury, right? If your pads are worn out, if your helmets aren't fitting right, cleats aren't fitting right, shoes aren't fitting right, that's just a setup for injury. And so that's, again, where we see things from a kind of a social standpoint interfere with equity when it comes to sports. So, we talk about things like the turf and the grass you're playing on, the equipment that you're playing with, the conditions under which you're playing, right? You see things like mismatches, right? You have one school where kids are huge, one school where the kids maybe aren't so much. That's just a setup for injury too, right? So these are all things we need to be cognizant about as a society when we're thinking about youth sports. Making sure, for instance, all the athletes are getting the best of equipment. Making sure we're testing and understanding what's the safest environment to play under. And then thinking about things like the weather and the environment, right? Maybe we don't need to be playing, in the darkest of the rain, even though we feel tough about it, what have you, right? We're just setting people up to be injured. And number 3 is the biggest one, and that's one I'm gonna probably stay on a little bit longer. And that's this trend towards playing sports year round. Now, many studies in our orthopedic literature have shown that those athletes who are playing the same sport in particular year round are just setting themselves up for injury. And when I say athletes, I'm talking about young athletes. I'm talking about adolescents and younger. Now, I understand the need or the trend or maybe the concept that, hey, I want to get my kid, playing this sport early on, which makes sense, right? Sports do a lot of things for us that are important, but that can go left if you take it too far to the extreme. The extreme being, well, that kid who plays with one team all summer, and then, for instance, let's say soccer, right? You play outdoor all summer and fall, and you play indoor all winter, and the spring right back to outdoor, and you're doing the same thing over and over again. Studies have shown that for adolescent athletes, that increases your risk for serious injury over time. And there's a few different reasons for that. For one thing, you're doing the same repetitive movements over and over again without variation, right? And so that joints or the joints in your body, they're taking the same stressors over and over again. Nothing's changing. You're not moderating how you do different things. You're doing the same movements. The other thing is that people become deconditioned, or rather I should say over-fatigued from doing the same thing over and over again, right? And they're not getting adequate rest. They're going straight from this season to that season, from this team. They're playing, with this travel team, then they're going back to play for school, and then back to the travel team, and then back to indoor, and they're just playing year round. They're not switching up their movements. They're not doing anything different. They're just simply using those same muscle groups over and over and over again without rest. And remember that first risk factor we talked about. Over-fatigue deconditioning leads to injury, right? So if you're over-fatigued from having done the same thing over and over again without resting in between, you're setting yourself up again, right? And then we gotta think about young athletes, especially the youngest athletes, right? A lot of times their growth plates or the areas in their bone that are still growing, they're still growing, yeah? So you're still growing, and then you start putting a whole bunch of force through that area repetitively, doing the exact same thing over and over again. You're gonna set yourself for long-term consequences and injury, and that can be devastating for some people. So the trend towards year-round playing the same sport really needs to stop. We can't have young athletes doing that. And to be honest with you, it's been shown that really that may not help you. You're probably better off mixing it up, right? So those athletes who are multi-sport athletes, they're using different movements, different muscle groups, and those different kind of things they're learning from different sports actually contribute to doing better in each sport. Now, as you get older, you're gonna specialize and maybe do just one sport as much. But even in that situation, there's gonna be an off season, right? And then you'll get adequate time to rest. But we really wanna encourage young athletes, and really their parents, is who I'm talking to really look at doing multiple sports rather than trying to do the same sport all year long, because that same sport athlete at that young age really is not good. So that third one is a big one. That's something that we're really trying to address as an orthopedic community, and really get the knowledge out that, hey, your kids are better off if we really switch up what you're doing when it comes to playing sports. So that's again some of the top 3 reasons why people get injured, and these are causes that can be preventable. Because really, I want you to not have to come see me or someone like me in my office. We'll try to keep you out of our offices. So thanks again for listening. We'll see you next time. Please like and subscribe for more content just like this.